Thanks so much, Miranda. Congressman Brad Wenstrup is inviting constituents to join him for coffee with your congressman in Amelia tomorrow. These get-togethers are opportunities to exchange ideas, ask questions, and meet your congressman. We have Brad in studio this morning talking about a host of topics, including Syria and also health care reform. Congressman, good morning to you.
Good morning, Dan. How are you?
Good, really well. Talk to us about the situation in Syria. I mean, it has been really evolving over these past couple of days. We've heard from the president. We've heard from, David Cameron in the UK. Your feelings on everything so far?
Well, one of the things that we're seeking right now is to have some congressional influence on what is taking place. There's been a letter going around, bipartisan letter, where a lot of Congress members are saying we want to have some stake in the game and we want to have some conversation about what is taking place. You know, I often say that when you get into these situations, that the enemy of your enemy is sometimes your friend, but sometimes the enemy of your enemy is a larger enemy. And that's really the situation that we face in Syria. One of the things that we are doing is humanitarian aid into Jordan, which is an ally of the United States, a friend of the United States. So a lot of people are fleeing Syria, and we're taking part in that humanitarian effort there, which I think is good. But the real conundrum is this red line issue.
Well, and you're seeing video of the situation right now on your screen, and you've been in war. We've talked about that. The tragedies of war are numerous, but of course when you see that chemical weapons were used in this situation, which has now been confirmed by the Obama administration, and also we're hearing from the UN, that's that red line.
And that's what changes the dynamic, right? And the president said that long ago. He said if they go into this, that's the red line that we cross. Well, the situation is, what does that mean?
Yeah.
So crossing that red line means what type of reaction from the United States. And with any military mission, no matter what it is, you've really got to sit down and evaluate, what do we hope to accomplish? Where are the national security issues in place here? What are the interests of the United States in reacting to something? But how do we go about this mission? What do we hope to accomplish? And how do we get back out? And how do we do it efficiently? Those are all the factors that come into play. It's a big chessboard in this one.
Yeah, and how long? When do you think a decision will come either way?
Well, I don't know, because at this point we haven't been called back to Washington, so there hasn't been a conversation taking place there. Now, I will tell you that the Speaker has had some conversation with the administration, and so has the Chairman of the Armed Services Committee, not directly with the President, but with his staff. So we're getting updates on that, but to date we really don't know what the plan would be and what the outcome is supposed to look like.
As a doctor, we're going to talk about health care reform. Your thoughts on all of that? That has been bubbling for years now.
Right. My thoughts on that, well, what we want to see, as so many Americans do, we want to see a delay or defunding of Obamacare. It's not ready for prime time, as they say, and the president knows that, because he's starting to basically defund it or take away parts of it. And so we have to look at this realistically. You can take the approach that it's the law. Some people come up to me at these town halls and this and that, and they say, well, it's the law, you got to live with it. Well, if it's a bad law and it's going to harm Americans, we shouldn't just sit back and say it's the law. We've got to make some changes here. And you're starting to see the president do it, but we want to take it even further.
Appreciate that. Congressman Brad Wenstrup, great to see you. Thanks for coming in this morning.
My pleasure.
Of course, we will continue to follow all of the latest developments on those stories on our website at fox19.com. Tracy, over to you.
All right, Dan.